I think moving and staying moving is incredibly important. And a lot of people think that, everybody needs to go to a yoga class and go do cycling and do all the crazy things I do. I don't feel that way. That's not really what it's about. And everybody is so different. And what's important is to find what you can do every day and to also learn to move throughout your day in a way that actually helps your body. So there's certain ways that you can get up and down from the chair. There's certain ways that you can even do things in bed. Whatever it is, the best thing to do is to find a way to keep moving. There are some days where I can go cycling and then I go to yoga and then I'm like running around with the kids and I'm like, God, I feel great. And then there are other days where I literally feel like I'm Velcroed to the bed and I'm like, I'm gonna die. Like, what is wrong with me? And I've learned that you go up and down. It is an up and down battle. It is, and I don't worry about it anymore because it's just what it is. I don't run to the doctor all the time. I just know that the first thing I do is I think, okay, what can I do today? I'm gonna focus on what I can do versus what I can't. How am I feeling? Have I been dehydrated? How's my nutrition? How have I been eating? Have I been really stressed? Was I up really late last night working? Which has been my norm lately. And you know what? It just destroys you, right? So instead of feeling like I've got some new problem I need to run to the doctor, I just focus on what I can do that day. And then if there's a consistent problem, I seek help. But the most important thing is moving. When the body doesn't move, and then you don't also take care of it nutritionally, deconditioning happens. And deconditioning is not good for anybody, and it's really not good for a hypermobile person. Besides being really talking about just 5 minutes, something I've learned since January, I have used the computer a lot more. I published a book. I was working on 2 businesses, doing Wellapalooza is including one of them, and I've been a lot more on the computer. I've tried. I can't sit also. Sitting is probably one of the biggest things that causes me pain. So I've been sitting more, I'm in more pain, I can't find a chair, I've tried exercise, I've tried everything. I have a treadmill desk, that even caused problems. So where I am right now, and Dr. Pocinki, who's going to come as my doctor, I have, even with staying active as much as I am, just because I have worked on the computer more for 9 months, I have deconditioned so bad in my upper back and my neck that I can barely hold my neck up in a sit-up. That's how fast it happens. And I'm still active. I run around with the kids, I work out. It's just from sitting more during the day. I'm just not up and around doing everyday things. And that's been quite shocking, really shocking. I've had more, like if I do a push-up, I have this like clunk in my neck. I never had that before. I have a constant whooshing in my head now, and that's, so we think it's from muscle spasms pressing on my carotid artery. It has been crazy and shocking for even me, and I talk about this all the time. So just 5 minutes is my big thing, and it was a rule that I made for myself when I was in college and then I was in high school, and I was always really tired. And I would say, focus on just doing something for 5 minutes, even if it's like moving my arm or moving my leg, just get going. Who can't do something for 5 minutes? And half the time, once I got moving, I felt better, and I would keep going. I never stopped after 5 minutes. Even when I felt really bad, I still did something, even laying on the ground for 10 minutes. So that was always my trick. I still do it with work, I do it with my kids, I do it with cleaning, I do it with like anything. I really don't feel well, it's like I think, just get moving for 5 minutes. So that's kind of how I try talking to people about physical therapy and exercise with PDS and massage. Just focus on what you can do every day, not what you can't. Focus on how you can move better, move more, and what you can do for just 5 minutes at home. If you can't do anything else, just do leg lifts on the bed for 5 minutes, do arm circles, do mindfulness, even if you're just laying somewhere for 5 minutes and just being calm. Whatever it is, you're doing something that's helping you keep moving forward. And we're gonna have the days where we're really up, and we're gonna have the days where we're really down, and you just have to go with the flow. And as long as you're consistently kind of moving towards a better pattern, you're good, really. If you get really bogged down with the highs and lows, you're gonna drive yourself nuts, because we all have that. And the first thing I do is, as I said, look at what's going on in my life, stress, nutrition, fatigue, book writing, Wellapalooza, sitting more. There's a lot of things that are going on. New medication. I have more reactions to medications out of the way. I literally take only 2 because I can't, and I still react to those. So there's so many things that play a part. Hydration is a big part. So what I do hypermobility talks, we really talk about how ways you can learn to move better during the day when your normal things. So one thing is like sitting in a chair. And how do you get up and down from sitting in a chair? So people that are hypermobile have hypermobile pelvis a lot of times, right? Well, one of the things that also happens is that naturally we don't have very good glutes just by the way that we're formed. Some people do. I certainly don't. I work my butt off literally for it. And so, but if you learn a way to go up and down the stairs, if you learn how to get up and down from a chair, you can actually kind of do this all day long. And you can do it while you're just doing your normal stuff. And it could just be something you're doing. And it could be your 5 minutes, you sit there and you just practice getting up and down from a chair. That's all you can do every day. So I think learning how to like get up and down is really important. Another thing I think is really important, and before I show you, is when I stand, I'm never standing still. And if I'm in the operating room for my job, or for my medical sales business, or if I'm in the line of the grocery store and ask my husband, I never stand still. I'm constantly moving. One, because standing still causes pain. But two, I figure if I'm just going to sit here, I'm going to do something that's going to help myself. So a lot of times I do leg lifts. I do like this in place. You know what that's really good for? Blood pooling. You know, anybody that has POTS, dysautonomia, they tell you to do that. They tell you to pump your legs, to do leg lifts. Okay, I do like ballet things because it engages my glutes more. And I focus on my core. And I kind of like go up and down like this. I do squats. And sometimes I do like ballet things, like anything to keep my legs moving. And I don't think that, I'm not really sure that there's really too many people that really can't do something like that. I think that that's pretty safe, it's pretty benign. And then I've had patients that talk to me and say, Kendra, I can't even stand up. I said, that's fine. Lay in your bed. Do some arm circles. Do some leg lifts while you're laying up and down. Just whatever you're doing, just focus on it and just be there for 5 minutes, just doing it. You're still moving. You're still going farther than if you didn't. So I just try to do whatever I can, as much as I can, with whatever I'm doing naturally. And so standing and just not standing in place and doing like leg lifts and, you know, sometimes I do the I like this because it engages my glutes more. And then I also do like this, just because honestly it also helps my feet. Does anybody have flat feet? Okay, so this is really good for your feet. Okay, it helps your feet muscles. So if you're just, does anybody see what I have? You're going up and down like this. It really helps strengthen the balls of your feet. And then I can do a V, which is like, you know, first position in ballet. And I just go up and down. This one's a little bit harder. This one really engages your glutes in my opinion, and that's a good thing. A lot of times I have leg pain. It actually feels very good on my legs. I like to move when I'm in pain. I found that movement helps me quite a bit. It may not be like a cycling class. Sometimes that helps, but sometimes I just need to move, and movement helps. So this is another reason why I did that. I really like, you know, the ballet things. Sometimes I do wall split in the operating room. Let's see, what else did I do? So I say definitely leg lifts, and then also learning how to get up and down from the chair appropriately. So I'm going to put this on so we're so if you're sitting, everybody's sitting, right? You guys can actually do this too. I don't think anybody really here has a problem. I can't get this.
Does it count if your SI joints are so out of whack that your glutes are so tight up in there?
Yes, well, I have, so last winter, I fell, and I really severely injured my tailbone. And I see a colleague that works with physiotherapy associates, and he does the hypermobility talks with me, and thankfully I was strong enough that when I fell, I don't know how, it saves my SI joints didn't stay away. Amazing enough, but I deconditioned so fast. And he said, Kendra, he's like, I'm shocked. I mean, you just deconditioned so fast. And I still was stable, but like I can still feel it, and I still have to do a lot of work. So if I'm sitting in a chair, one of the things, other than focusing on how good you get up and down, I also do, like, I contract my glutes a lot. You guys ever do that? So if you're sitting in a chair, sit up, and like, now sometimes this also, what it does is it kind of like, my SI joint will pop. You guys ever do that? Okay. So you ever contract your glutes? Like try to contract your glutes when you're sitting? You guys ever do that?
Squeezing your butt?
Yeah, squeezing your butt